Well, multiple studies suggest fewer cancers were diagnosed last year. That's not necessarily a good thing. Dr. Shaun McKenzie, surgical oncologist from Texas Oncology and St. David's Medical Center, joins us this morning to talk about what needs to be done to increase those screenings. Morning, doctor.
Good morning. Sorry for the phone. We're having some audio issues.
Now, we take a lot of calls this way now because the last year, the pandemic has changed so much. And that's kind of what we're talking about with you. It's changed your work so much and the screenings that people would normally get in a typical year.
Yeah, it's really been an issue. I think as cancer physicians, we've always been a little concerned that a hidden casualty of this pandemic would be our cancer population, but now we're actually starting to see that that's a reality. We are seeing patients with more advanced disease in the office on a daily basis, and that's across the country, not just in Texas. And if you look at some of the studies on previous screening protocols, such as lung cancer, where typically less than 10% of screenings showed a suspicious tumor in the lung, in some studies, it's up to 30% of recent screenings. And so it's absolutely a reality and something we're watching very closely.
And it's so frustrating because one of the things we know about cancer and the fight against cancer is that, developments are made all the time, and so much more so now than ever before. We see good outcomes when cancers are detected early, whether it's getting into remission or certainly just better outcomes living with cancer, but it's all based on these screenings and this early detection.
Yeah, you're absolutely right. I mean, the treatment for cancer has improved significantly over recent years, but at the end of the day, it still remains true that the earlier the cancer is found, the best chance you're going to have of a cure. And if you look at the three most common causes of cancer death in this country, lung cancer, breast cancer, and colorectal cancer, all three of those have very successful and defined screening protocols. But, when up to 30% of the patient population has missed their screenings last year because of fear of the pandemic, those numbers can't be avoided, unfortunately.
Yeah, I would imagine going forward, obviously, you never want to panic anyone. You need to back in there, but at the same time, you want people to take this serious and get those screenings scheduled and just get back in and get those checkups that they need.
Absolutely. I mean, that's a great point. I mean, we're not here to scare everyone, but the reality is that it is exceedingly safe to have your screenings at this time. Every screening center has defined protocols. The incidence of developing an infection during a screening exam is really negligible, and it is completely appropriate to get back to taking the other components of all of our healthcare seriously. Yeah,
very good point. The cancer screenings and just anything else that might be pressing on someone's health or just part of your regular health care, it's important to get back to do that. Doctor, thank you so much for your work and your time. We appreciate it.
My pleasure. Have a great day.
Dr. Shaun McKenzie.